the reason why I started Increda-dental is because my dad, he was a dentist. He loved practicing, loved his patients, and practiced for many decades. He practiced until the age of 76. He was diagnosed with leukemia, and 6 months later, my dad passed. And as we got into his practice, as we worked on selling it and trying to get things ready to sell, we realized that his practice was not the joy that he talked about, that his practice really held him hostage and that it ruled him. And it was a really somber moment realizing that his practice wasn't healthy. And I just want practice owners and dentists to know that you work too hard to have your practice not be your joy and an enjoyment, but to have it hold you hostage. I want to help your practice become the practice that you dream about so you're more successful, also leading to greater joy for you to balance between home and your work, but also for your employees as well. But don't forget your patients, because when you are in a happier place, you're providing better care, you're enjoying your patients more, and life is just easier. So KPI, the KPI I wanted to speak to you about are two that almost every office can tell you right off the bat. We'll ask, what are the two things? What is something you're tracking? And they'll say, well, our production is this X amount of dollars this month, and we gained X amount of patients this month for new patients. Almost every office keeps track of that, which is great. That's a good start. But a lot of offices are missing attrition. Attrition is the number of patients that are not returning to your practice that are due for treatment. Now, you can choose to have the attrition rate be 1 year, 15 months, 18 months, or 2 years. Choose whatever number works for you, but you want to pull this number and pull it on a weekly basis. I like to choose 15 months for patients that are considered in attrition because it allows those patients who only like to come in once a year for their dental cleanings to have that time to schedule. It gives a little wiggle room, if you will, to get scheduled for their appointments. So that's why I like to choose 15 months. Now, I also like to have this pulled once a week because it gives a focus for the person who's in charge of your practice of reaching out to patients who have not been scheduled to reach out to them and get them back into the practice. Now, this is not something for the provider or the practice owner or the dentist to track. This is something that can be delegated and needs to be delegated to either the office manager or the hygiene person, the assistant, if you have someone along those lines. This is material that you should be able to pull from your software very easily within 2 to 3 minutes. Every software is different, but find out how to pull this number because the easiest patient to get into the practice isn't the new patient. The easiest patient to get into the practice is a patient that has already been to your practice. So delegate this out and then follow up with them once a week. Then from here, you want to find out why patients aren't returning. Is there a pattern? Maybe it's a seasonal thing where you're in a college town. A lot of people move out during the early summer, late spring area. Maybe it's something like a military base that's close by. But you want to brainstorm and figure out why people are not returning to your practice if there's something going on there. Because numbers tell a story. One practice we worked with, they had a great practice. They were getting in 50 new patients on average every 2 weeks, so 25 roughly patients a week, which is fantastic. But what we learned was that there was a low number of returning patients. People were not returning to the practice. So we did some reaching out. We asked people to fill out some surveys to find out why people weren't returning. And the reason why people were not returning was that the front office person who checked out the patient, they had a lady who was really rude to them. She treated the patients more like they were a burden, that they were annoying her, that they were there as kind of as a commodity, but not as a patient of someone who is being provided care. And they found that she was being demanding and disrespectful to the patients, and it ruined their return rate of patients. So you want to look at these numbers. You want to be very careful about what's going on in your practice and see if there's a story that's being told by patients not returning. Now, you can pull the last 3 months of attrition, but the most relevant numbers are the ones that are the most recent. So pull those numbers for the last 2-3 weeks, and then start pulling those numbers every week of patients that are not returning to the practice. After we worked with this office, worked on our skills of how to check out patients, how to get patients to return to the practice, we started having patients returning at about a 95% rate, which is amazing. So people can learn how to bring patients back to the practice, but they have to have the right skills and the right understanding of why they need them to return and how their wording matters and how it impacts the office. Because when we do this, we're more powerful as a practice, and we're also helping the patients to get to better health. So start tracking this number of attrition, record it weekly, have it assigned to a staff member, and allow opportunities to find out what is going on, why this number is dropping, or also why this number is high. Because maybe there's some things you're doing really right, and these staff members need to be complimented. You need to praise them because what they're doing is keeping you in business and keeping things on the lighter, brighter side. Thanks for joining me. I'm Alicia Flynn from Increda-dental.